to ensure that we're picking up the people who are most likely to have it, contain and isolate those, and contain the spread. The CMO will talk more about that in his briefing later. So we're trying to be very transparent and open about all of the actions we're taking. So the NEFIT has also put together a dashboard, and that's going to be live on gov.ie with some of the dashboard information. I think we can see that there now. So that's going to be live from now on and updated regularly. So on the advice of NEFIT, which met yesterday, to continue efforts to limit the spread of Covid-19, further restrictions were put in place, and much of this has already been covered in the media, but I'm just going to recap for you here. So individuals should work from home unless attendance at workplace is essential. Schools are to remain closed until April 19th. Non-essential retail is to close to the public along with other non-essential commercial businesses, and we've put a list of the essential retail outlets up on gov.ie for people to see. All playgrounds are to close and all sporting events are to be cancelled. And restaurants are being asked to limit their service to takeaway. And just for those businesses out there, those restaurant businesses, just to emphasise, we are waiving the change of purpose consent form on that for the duration of the emergency. Further economic measures have been put in place to continue to assist both businesses and the many individuals who have been affected by the economic impact of the crisis, and to ensure that they are supported through the coming difficult weeks. This is a comprehensive and extensive income support package worth around $3.7 billion. So there's a COVID job seeker payments which will rise to $350 per week, and a temporary wage subsidy scheme which will be available, wherein eligible employers will be subsidised 70% of an employee's take-home pay to a maximum of €410. The most important thing that the temporary wage subsidy scheme achieves is to maintain the link for people with their employers. When the public health crisis has passed, and it will pass, employers and employees can very quickly get back to business. So for employers, you need to go to the Revenue website and look up details for the temporary wage subsidy scheme. And if you're an employee or self-employed and your work has dried up due to COVID, you go on to mywelfare.ie and claim the COVID payment. So in terms of financial supports, the significant number of applications for income support has been received in the first week of the economic impact of the pandemic, gives us a sense of the scale of the economic shock. The DASP received 103,000 applications for income support, either the new COVID pandemic unemployment payment or the job seekers payment in the week ending Friday the 20th of March. Payments were made yesterday to almost 60,000 of those applications. The Department is preparing a weekly statistical report with the view to publishing every week so that we can have transparency around the number of applications being processed. I want to stress that the quickest and easiest way to access an emergency COVID-19 unemployment payment or a job seekers payment is going online and applying through the www.mywelfare.ie. This is vital in order to ease pressure on the staff of the Department of Employment Affairs and Social Protection, and by reducing footfall in the intro offices, and to comply with social distancing measures. Beyond those welfare measures, we are aware of the impact for mortgage holders and business owners. Banking and Payments Federation of Ireland have calculated that banks are fielding 7,000 daily calls around mortgage payment breaks and 500 business customer calls seeking payment breaks or modification daily. Banks are making huge changes to their operations to be able to manage those calls and work through those issues with customers. So in terms of community support then, just around crowding in public spaces, there's been a huge upsurge of visitors to local amenities, including the national parks, and we know that people are very concerned in relation to public health and social distancing. In response, we organised a teleconference with the relevant public bodies on Monday. We want to reaffirm that going outdoors in groups of 2 or 3 is fine, and it's good for your physical and your mental health to get some exercise. But you still need to keep 2 metres distance from the nearest person to you, even outdoors, unless they live in your house. To that end, the situation in parks and gardens is being constantly monitored and kept under review. We're continuing to stress the importance of social distancing at these sites with signage and large-scale electronic displays in certain areas. Various methods of demonstrating the correct distance of 2 metres are being employed, online campaigns and examples painted on footpaths and parks, and we're increasing park wardens and guards in place in parks to help increase distancing being observed. I really want to recognise the work of all of those people involved in those different parks and areas and on Garda Síochána who are working hard with communities across the country on social distancing, and we all need to work together on that. In terms of volunteering, I also want to thank all of those who have volunteered so far to help in their communities, in particular to help support vulnerable members of communities, and it's really heartening to see how everyone is pulling together. The government is working hard to coordinate that response and ensure it's carried out safely. So again, we would ask people who want to volunteer to go on to gov.ie and click through to the volunteering links there so that they can register what they're available to do, their skills, and that we can carry out that volunteering, match the skills up and make sure it's done very safely, especially for vulnerable people. In terms of homeless households, the Department of Housing, Planning and Local Government continues to work closely with the HSE and the National Public Health Emergency Team in relation to the response for homeless households. Local authorities have specifically secured additional emergency accommodation to ensure that there is sufficient capacity to allow for the isolation of confirmed and suspected cases of Covid-19, and we're continuing to monitor this situation very closely. In terms of tenants, landlords have been asked to show forbearance at this time. While tenants will be expected to pay rent during this period, income supports and rent supplement is available to those struggling to do so. I also mentioned something the other day in relation to protecting consumers, and I want to reiterate it again today. We have the Competition and Consumer Protection Commission has issued a warning to customers in relation to websites selling hand sanitizer products in particular. It's www.whatadeal.ie. They are concerned regarding the information being provided to customers on this site, and they have been concerned that a small minority of traders may engage in commercial practices which are damaging to consumers, particularly vulnerable consumers. We are actively monitoring to check compliance with consumer protection law and taking appropriate action to protect consumers. So that's something we would like people to be very aware of. In terms of protecting our citizens abroad, the Department of Foreign Affairs are continuing to work on organising a repatriation flight for Irish citizens stranded in Peru, but the date of this flight will be dependent on the relevant permissions from the Peruvian authorities. They're encouraging any Irish citizen travelling abroad to download their TravelWise app, which helps Irish citizens stay safe and informed while travelling. In particular, they want to stress that any Irish citizens currently in Australia should contact the Irish Embassy in Canberra or Consulate General in Sydney by email to share any concerns they may have. And all citizens abroad are encouraged to register their contact details on the citizens' registration. There's a lot of work going on behind the scenes in relation to the Australia situation, just to say that. In terms of the Department of Transport, Tourism and Sport, in accordance with the advice of the Chief Medical Officer and the NEFIT yesterday, no cruise ships are allowed into Irish ports on public health advice. But just to also confirm that the Shannon Group has confirmed that Shannon Airport is continuing to facilitate flights to get passengers home and for essential services. It is particularly important to keep airports open to facilitate the transport of essential and emergency goods in these unprecedented times. I think I mentioned the bank closures at my previous briefing. Just to reiterate, this has no impact on cash availability in ATMs at these branches that are closed. Customers have access in any of the 161 branches which remain open. In relation to elderly customers who do not use ATMs, almost all, 85% of the branch closures are self-service branches with no counter service. And the Bank of Ireland has an hour dedicated to seniors every day in open branches along with a dedicated helpline. And just to say, the majority of those branches are largely in universities and third level education areas which are closed in any event. So now I'm going to introduce the Taoiseach, the Minister for Health and the Chief Medical Officer to introduce a public health campaign that's going to be launched today. And in addition to that, I'm going to introduce David McRedmond, the Chief Executive on PUST. They're doing a number of really important initiatives and he's going to tell you about them today as well. Thank you.
This is it, everyone. Everyone hold up your leaflets. Kick off. Minister, ladies and gentlemen, good morning. First of all, my thanks to David and the staff of An Post for joining us to launch this booklet, which will help protect and save people's lives. We now live in a world that has been transformed utterly, perhaps forever. And to protect each other, we need to keep a physical distance, but we also need to stay connected. And An Post is helping us to do that. Our country is very grateful to your staff for keeping families connected, no matter how distant. And every single person involved in sorting post and delivering the mail is doing an essential national service. It's a service that many of us will depend on in the weeks ahead, and we thank you for it. I also want to congratulate An Post for being innovative in thinking of new ways to help us keep in touch with our loved ones. This includes the really excellent idea of sending 2 postcards to every household that can be sent anywhere free of charge. And I know you're working on some other really interesting ideas as well that you might share with us later. This new information leaflet is going to be sent to every home, free of charge, and that reflects your commitment to public service at this historic time. The public information booklet explains what we're doing as a country, what we need to do to slow the spread of the virus, and it brings together the best advice from our medical health experts in line with recommendations of the World Health Organization and the European Centre for Disease Prevention and Control. I encourage everyone to read it when it arrives. We may think we know what we should be doing, but we live in an age of misinformation and disinformation, and we're in a constant battle to get accurate information and truth out to the public. And this is the basic primer, the basic piece of information that everyone needs to know and absorb as soon as you get this to your letterbox. It's very easy to be misled, and this book cuts through the confusion. In doing so, performs a vital function, and my thanks to the team in the HSC and the Department of Health and government officials for putting it together so quickly. I think there are many things happening in our country right now that give us hope for today and for the future. The determination of people to think of others, to help others, and to serve others is a shining example of Ireland at its best. Also people providing vital services in our hospitals, our supermarkets, in our sorting rooms. We also see it in the work of those in religious life, of all denominations, our Gardaí, our Defence Forces and our civil servants. Every single person making a difference in the best way they can. The Belfast-born writer C.S. Lewis, some of you will know the Narnia Chronicles, and I loved them as a kid, and I hope some kids who are stuck at home, if they haven't read the Chronicles of Narnia, will do so over the next couple of weeks. And he's an Irish writer, Belfast-born, and in one of his novels, I think it was The Horse and His Boy, they talk about what it means to be afraid and how to overcome it. And one of the characters, the horse, says to his boy, "Everyone is a bit scared, but we're a little less scared together." And I think as we practice physical distancing and work to flatten the curve and suppress the virus, we need to remember that we're all in this together. And if we keep looking after each other, we will come through. Thank you very much.
Thanks very much, Taoiseach. Good morning. It's so easy, I think, for all of us to feel powerless when a sudden a threat like Covid-19 emerges and turns our everyday life, our everyday world upside down. All the certainties, or what we thought were certainties in life, can vanish and can vanish overnight, and indeed the future we had in mind can at least temporarily disappear from our view. But we do need to remember, no matter how many measures we announce here as a government, that it is in our hands to rebuild our future and to get through this crisis. We are absolutely dealing with a global crisis, but the actions we can take at a very local level can and will make all the difference. As we've said before, and as we will continue to say, doctors can save hundreds of lives, but acting as united communities, acting as families, we can save many, many thousands. So I do have to keep reminding people that the power is in literally their own hands to affect the impact of this virus on ourselves, on our loved ones, and on people in the community, especially those in the community who are vulnerable that we need to mind. So obviously knowledge is power. And there's a real thirst for knowledge at the moment. Everywhere we go, people want to know, what can I do? What can I do to make a difference? What can I do to keep my family safe? How do I make sure we look after particularly older relatives? And information is power, and that's very much at the heart of what we're circulating in this booklet today. At all times, we will be giving people as much information as we possibly can to help them manage. At all times, we'll be honest and blunt in our assessments, but we're very conscious that there's an awful lot of information out there. So we need to actually somewhat, for all of us on an individual level, take it back to basics. What we're trying to do here is provide you with simple advice that you can use in your own homes and in your own community to play your part in slowing the spread of this disease. So it is up to you to play your part. And I know this is not easy, because the extra measures that Taoiseach announced yesterday are important, but they're an extra imposition on all our lives. They're a challenge. They require us making sacrifice. I'm conscious that there are mums and dads with kids at home trying to find ways to make a very abnormal life bearable, perhaps at times, trying to go to work as well, perhaps, and do their best. I know there are people who had the shock of losing their jobs, perhaps only yesterday, trying to pick up the pieces today, whilst at the same time being asked to do very difficult things. And we know that there are all different types of families, each with their own unique circumstances, trying to balance everyday life with this very strange new world that we temporarily inhabit. We understand that there are people who live alone, people who are worried about being lonely and isolated. And we know that there are people with particular challenges who depend on others for support. And everybody has questions, many, many questions, as we adjust to what is a great period of change. So to all those people today, we're reaching out very directly, in the most direct way we can, putting a booklet through your whole door, a booklet we're circulating for you. And it's to help you answer those questions, and it's to help provide you with consistent expert advice from our Chief Medical Officer. So I really hope this will be a useful resource for you and your family. So when you get it, sit down, have a chat with the family. What can we do in this booklet? Are we doing everything right? Is there something more we can be doing? And this will answer many, many of your questions. I want to thank the communications team in my own department for their huge work on this. They're working in a very intensive environment, as you can imagine, in putting together this booklet, particularly under the leadership of Deirdre Washers and Aoife Gillivan, and all of their team as well. It wouldn't have happened without you. In every way we can, we're going to try and keep in touch with you throughout this crisis, just like we need to keep in touch with each other. And as we hear everyday tragic stories from around the European Union and across the world, I think that has to bring home to us just how devastating this virus can be if we don't get this right. But it's in our homes that we will stop the spread. So please do stay at home as much as possible. Please do follow this advice. Work from home as much as you can. Keep your distance from others and talk to your kids about them doing the same. And I want to also today just send a special message to everyone at home that is feeling anxious about their own mental health and well-being. This is a really anxious time. I thought the Taoiseach was very honest about this yesterday. This is a time where we're all a little bit worried. That's to be expected. It can be anxious when we have less contact with our family, less contact with our friends, and we need to be conscious of that. So if you're sitting at home today and you're worried about your mental health, go to yourmentalhealth.ie, because we do together have the power to lessen the impact of this virus, but also to keep ourselves strong throughout that period.
Good. Thank you very much. Thank you, Taoiseach and Minister. On behalf of An Post, the 4,500 postmen and postwomen, and also all the people who work in post offices throughout the country, we're well aware that we have two essential networks that can help the country in our own small way through this period. We're delighted to be distributing the booklet, and I should say that postmen and postwomen are doing this for free as part of their service. We also have a number of ideas and initiatives that have come up from postmen and postwomen through their union, Communications Workers Union, led by Stevie Fitzpatrick, and between them they've come up with a number of initiatives that can really help. The first is to help connect the community. So postmen and women will now not just deliver the post, they will call in on older and vulnerable people living in the communities, being a practical and trusted person, usually known to those people, to help them. And they'll go in with a set of questions such as, do they need food? Do they need pharmacy? Do they need to send out messages? And the postman or postwoman will then take that back, and we will look after that and make sure that that gets fulfilled. The second thing is to help people stay in touch. We will also take parcels and letters from the elderly and the vulnerable, and we estimate that's about somewhere around 10% of homes, about 160,000 homes, will take letters and parcels and distribute them for free so that they can stay connected with their loved ones. The third one is to help say hello. We're encouraging everyone to reach out to friends and family. As the Taoiseach has mentioned, we are distributing 2 free postcards to every home. We've distributed 2 million so far. We're going to distribute another 3 million to homes, to nursing homes, to everybody in our society, to prisons. Everybody is going to get these cards so they can write to their loved ones and let them know they're thinking of them while staying apart. And then finally, to help people keep up with the news, and we know just how important professional news and newspapers are to people, so we're working actively now with the National Newspapers of Ireland and with the local newspapers of Ireland to find a way so that we will, by the start of next week, be able to distribute newspapers to people, and people will be able to register to get those newspapers delivered. We'll start off again with the elderly and vulnerable, and then we will roll that out. So that's a set of measures which have been developed between government and PUST and the Communications Workers Union, with ideas coming from the postmen and postwomen. Thank you.
If I might just add, then we're very pleased to see this initiative on the part of An Post in helping us to get this information out. From the beginning of this, we've talked about the importance of personal behaviour, and in particular the importance of you as an individual in the community, being responsible, being responsive, being informed. And the way that we keep people informed and ensuring that they follow the right advice and follow the right behaviours is give them trusted information through trusted sources. We've continually emphasised the importance in online information of hse.ie as the place to go for trusted information. We're now in a position to continue to provide people in the public with more information from the trusted yellow, which is in this leaflet, and we're very grateful to An Post for helping us to reach the community in every household through the distribution, and in particular people in households who might not have access to hse.ie.
This is a question for the Taoiseach and perhaps the Minister for Health. Yesterday you took some extraordinary decisions, including creating a single-tier health service for the next 12 weeks at least, and also in guaranteeing or seeking a guarantee from childcare providers that they wouldn't charge parents who are now being forced to look after their children at home. It's going to be very hard to roll back these measures in 12 weeks, is it not? Can you speak to that really, as to whether this is now the direction of travel we are heading, or whether we now in 12 weeks' time or whenever this emergency ends, people will be expected to pay a second mortgage for childcare, people will be subject to a 2-tier health service? And secondly, for the Taoiseach, the Ceann Comhairle has confirmed now that TDs and senators will not be able to pass new laws, or the Oireachtas will not be able to pass new laws after midnight on Sunday without the election of a new government, the election of a new Taoiseach. That, I suppose, underlines the urgency of creating that government. Do you think it can be done in the next 10 days? And do you think you should remain as Taoiseach, and that the Minister for Health should remain on, and other key ministers should remain in their positions if and when any new government is formed with Fianna Fáil and others? Thank you.
Yeah, just on the first part, I think it's... I don't think we should exaggerate what has been done. We've created a single-tier health service for the purpose of treating COVID-19. That isn't the case across the board for all illnesses. People attending their GP today with, let's say, chest pain, or somebody going to the local minor injuries unit with a sprained ankle, will still either have a medical card or not have a medical card. So what we've done is we've created a single-tier health service for the purposes of treating COVID-19. We did that only a year ago in relation to abortion services, where there is no charge and it's part of the universal health system. We've done that in relation to the mother and baby scheme and women's health for a very long time. So, this isn't something that's happened across the board. It's happened for a period of time for a particular illness. I'm somebody who believes in universal health care and having a single payer and a single health service, and I always have. But to say that we've somehow magically done that in the last couple of weeks and it can be made permanent is not accurate. It's been done for the purpose of treating this particular illness, COVID-19, in the way we have done it in the past for other particular illnesses, including infectious diseases, including vaccinations, including the mother and baby programme, including abortion services. So it's actually not unprecedented in that sense, but it is significant, and we've done it for the right reasons. On your second question, I didn't see anything from the Cairn himself, so I don't want to comment on that directly. But I do think it is possible to form a government in the next couple of weeks. But to form a government, and I think we're going to need a government that's going to last, that will last till 2024 or 2025, it's going to need a working majority. And that means it's going to require more than Fianna Fáil and Fine Gael. Between the two parties, we only have 72 seats. I think to have a stable working majority, you're going to need 82 to 85. So that means having at least 10 more TDs who are willing to come on board, take the whip, stay the course, be willing to make the tough decisions as well as the popular ones for the next 4 years. And we're not there yet, but we continue to negotiate with Fianna Fáil. There are discussions happening today, and we'd hope to get to the point where we can then approach other parties to see if they're willing to form part of that new government.
Sorry, I take the point in the House, but in relation to childcare, for example, it's going to be very hard for parents to be told in 12 weeks' time or whenever the emergency ends that they're going to go back to paying second mortgages.
Okay, well, what parents are being told is that for the period of this emergency, they don't have to pay for childcare that they're not receiving. Because what was happening in some parts of the country is childcare providers were charging parents for childcare, even though they weren't availing of that service. Now, because of what Minister Sapone secured yesterday, that won't be the case. Parents will not have to pay for childcare that they're not receiving, and the place that they have will be guaranteed. And I think that takes enormous burden and worry off parents, having to pay a bill for a service they're not receiving, concerned that if they don't pay it, that their kid won't have that place in childcare in a few weeks' time. We've removed that worry, and I think, again, that was the right thing to do. But I think most parents would acknowledge that if they are receiving a service such as childcare, that they should make a contribution towards that. Now, again, I've always been of the view that parents have to pay too much for childcare. That's why we introduced the National Childcare Scheme, and it was always intended that the National Childcare Scheme would be built on as resources allowed. So ECHE gives parents free preschool, the National Childcare Scheme gives parents subsidised childcare, and as resources allow, it's always been the intention of government, and certainly would be my view and my policy, that we would continue to expand early childhood education, continue to expand the National Childcare Scheme, so that parents would have to pay less out of their pocket and more would be paid out of general taxation. But being able to offer free childcare to everyone without any sort of fee would not be the norm in many countries that I'm aware of. There's usually a contribution of some sort, and that will be the case when this emergency is over.
One question, perhaps with 2 parts.
That again.
Taoiseach, you said a couple of times that you expected there could be 15,000 cases by the end of the month. So on current numbers, 1,300 today, 25th of the month, that would seem unlikely, but what's your revised estimate for where we'd be at the end of the month, and what do you read into that? And second part of the question, perhaps to Minister for Health, what's your current estimate of the capacity of the hospital system as it now exists? Because we've been warned by yourselves on many occasions that the great danger was that the hospital system would be overwhelmed. So, broadly speaking, what is your estimate of its current capacity, both for non-ICU patients and for ICU patients, and at what number of cases do we start running into that sort of danger? Thanks.
Yeah, the estimate of 15,000 cases by the end of the month was based on a sort of 30 to 33% increase in new cases every day. That would be an exponential increase. That hasn't happened, at least not of yet, so it looks like that we're going to come in certainly lower than 15,000. That is, of course, 15,000 confirmed cases of coronavirus. There are many, many more cases out there that are not confirmed. But the number of confirmed cases, I don't think would be 15,000. And I hope that is some evidence of some of the measures that people are taking having some effect. But what is certainly the case is the number of new cases, is continuing to rise. I'd never read too much into any one day, but we're still seeing, not far off 200 new cases every day, and I don't think we can, start to even contemplate the idea that we're containing this virus until we start to see the number of new cases every day fall and fall consistently, and we're nowhere near that. And there's only a few countries that have kind of got to that space, like China, South Korea, a few others, Japan maybe.
Can I just add to that in answer to your question? So, I mean, it's far too early to be prescriptive in relation to this situation. As the Chief Medical Officer showed at his press conference the other day, we're very much at the beginning of this journey in terms of the curve, whatever shape that curve may take here in our country. I think, though, what is a cause of concern is the number of ICU admissions that we're now seeing, which is a reflection that there are a number of people in this country seriously ill in relation to this condition. So to anybody watching this broadcast, anybody reporting on this broadcast, this is an extraordinarily serious situation. And we don't yet know how this is going to play out in the coming days, weeks and months in our country. So we need everybody to do all that we're asking, because that gives us the very best chance of slowing down the spread. And that's a direct answer to your question in relation to capacity. We are growing the capacity in the Irish Health Service in new and innovative ways. You'll see us endeavouring to temporarily acquire hotels in the coming days, and a lot of extra capacity in that. You've already heard our intention to secure all of the capacity in our private hospitals, and I want to thank the private hospitals for their work in that regard. You'll be seeing new and different ways of working, people being treated in the community in clinical assessment hubs that in the past would have gone into hospital for other conditions. Our GPs are innovating at an incredible rate, doing so much over the telephone now to keep those vital slots free and keep people out. So everything can be done. Everything that can be done will be done to increase capacity, and the support of the Taoiseach and the government has meant that financial constraints have not been in place in this regard, and we're also trying to grow the capacity in terms of staffing. But that will not be enough. That will not be enough if we don't actually slow the spread. So I'd really appeal to the people to know that while your government, your health service, your frontline health workers are doing everything that they can, the direct result of those efforts will decide whether or not we can cope as a health service, and whether we can ensure that we have that critical capacity that we need. But I'd be very, very cautious of any kind of commentary that suggests that we're at a point in time that is, encouraging. I think it's far too early for that. The only sign of encouragement we've seen is the reduction in close contacts, and that's very welcome. That's people making a real effort on the social distancing. But this is very, very early days, and the path we take and chart will very much depend on the actions of all of us as citizens. Chief Medical Officer, do you want to add anything?
Just to say that Taoiseach is right. That's what we predicted at the beginning of about 33% growth day on day was exponential growth, which is what you would expect in an unmitigated situation if no measures had any impact on growth in cases in the population. We haven't seen that, and we're not expecting to see the numbers we predicted maybe 10 days ago being the numbers at or around the end of the month. Can we conclude from that the measures are beginning to work? It's giving us some early encouragement, but it would be far too early, as we're saying, to draw that conclusion. What we did see in the recent days is the number of ICU admissions increasing day on day. That's a very sensitive indicator from our point of view, and something we watch very closely. The number of infections has increased past 1,000 in terms of confirmed cases, and 45% of those are community transmissions. In other words, they're cases we are not able to identify the links and to determine where those cases may have come from. And it was for those reasons that, although we had a high degree of compliance in the population with the measures already in place, we felt that we needed to strengthen those further so we could anticipate and try to slow down the spread of this in a way that would give us the greatest possible chance of, although we're not at a capacity problem in terms of this infection in the hospital system right now, but to slow that down and reduce the likelihood of that occurring.
That would change your advice?
Yes. Yes.
Just a question for the Taoiseach and Minister Harris. There are nurses, student nurses working in our hospitals today who aren't being paid for the work they're doing. Is this fair considering the circumstances they're working in? And also, just secondly, there are nurses also who've been trained abroad who are saying that they're facing a bureaucratic nightmare when they try to get back into the Irish Health Service to help. What are you doing to address this problem?
Yeah, on the issue of student nurses, pre-reg fourth-year student nurses are paid, and indeed we agreed to pay increase for them not too long ago, but students who are in their earlier years aren't paid. But we are examining that as an issue, and I know the Minister for Health is going to develop some proposals on that. But the tradition has been that medical students don't get paid. Nursing students do get paid in their final year, their pre-reg year, and indeed have had a pay increase in recent times. But we are looking at that issue of student nurses more generally, particularly if they're carrying out clinical tasks where they're not just learning, they're actually contributing to the workforce. So that's something that is under examination.
On construction sites, do you think it was the right call to leave them open? I know all this time we've been saying we should listen to the experts, and surely the workers here are the experts. They're saying it's not possible to properly social distance while they're working. They have to lift things together, etc. And just secondly, on the reports of people coughing purposely into other people's faces, what message do you have for the people that are carrying on like that?
I think we do have an issue with construction sites, and a bit of work has to be done on that over the next couple of days. You know, the construction industry, in fairness to that industry, is one that knows health and safety very well. It used to be a very dangerous industry, has become a very safe industry. So they're good at health and safety, and they know, for example, about how to use protective clothing, and they do that. So it may be the case that in some sites it is possible to keep them open, and in other sites it may not. And we also need to make, I think, a distinction between sites that may be essential, those that are constructing healthcare facilities that we may need, and those that perhaps are not. But it is an area where there's going to be engagement by the authorities, the unions and the construction industry over the next couple of days to see what can be done and can't be done. But again, I have to emphasise as well personal responsibility. And we are seeing this, generally, and also in workplaces. People are social distancing while they're working, and then they all sit down together, to have lunch or have a break, or to have a cigarette or something like that. We're really missing the point as a society if we're observing social distancing when we're doing our essential work, but then totally disregard it when it comes to lunch break or tea break or cigarette break. We're totally missing the point, and I think we need to continue to emphasise that social distancing is always outdoors, indoors, at work, not at work. And it's never going to be possible to observe it 100%, but what we do know is that if most of the people observe it most of the time, more than 75% of the time, then it will slow the spread of the virus considerably.
Can I just say on the situation you asked in relation to this thing of people bizarrely deciding to cough in people's face? This happened to me yesterday, actually, as I was walking from here to my department. That man and woman on the street thought it was hilariously funny to come up and cough at me out loud and kind of then run off laughing. Can we please, as people, just look at what's happening in Italy, in the European Union, where we're seeing several hundred people a day dying of a virus that can be deadly to certain people in our population. And when you think, I think particularly of older people who are being targeted in relation to this, and there seems to be some sort of social media kind of game, but it's not a game, it's disgusting, going on, that you will target certain people in your community, generally older people, and go up and cough in their face, video it, have a laugh and run off. Just think if it was your own granny, granddad, mother, father, your own friend with an underlying health condition like cystic fibrosis. And the Irish people have been absolutely amazing in relation to this national challenge that we're all going through. But anything that takes off in relation to that on social media will have to be dealt with the full vigours of all of the powers that the state has. There's absolutely nothing amusing about it. It's quite pathetic.
If I could just ask the CMO maybe to bring us up to speed on the waiting lists for tests and how the decision to adjust the guidelines for the number of symptoms you may have could maybe ease those numbers. Just your thoughts on that. And the Taoiseach, if I can bring you back to Hugh O'Connell's original point on the Shannon, can you categorically give us information about whether after Sunday emergency laws can be passed by the government? And also just the same issue, an emergency budget, is that something that would be considered in the coming weeks, given the amount of money now that has been put aside for the emergency measures? Thank you.
Yeah, there are no plans to have an emergency budget, and if an emergency budget is required, it's probably required at the end of the emergency, because when the emergency is over, we'll know what the bill is, and also we'll know what we need to do to stimulate the economy to get it going again, and we'll know if we've the financial firepower to do that. So if there is a time for an emergency budget, it's not now, it's when the emergency is over, because that's when we know what the bill is going to be, that's when we know what we're going to need to do to stimulate the economy, and that's when we'll know whether we'll be able to borrow the money that we're going to need to borrow to do that. So that's months away, I believe, in my view, and it may even be September, October when the budget will be due anyway, but I can't predict that at this stage. Just in relation to the Seanad, as you're aware, the counting of the votes for the new Seanad begins on Monday. That won't finish probably until Thursday or Friday of next week. So we wouldn't be passing legislation anyway next week. But if, for example, come the week after, then we're into a difficulty because legislation could go through the Dáil. But if it went through the Seanad, it would be going through a Seanad that wouldn't be properly constituted because there would be no Taoiseach's nominees. And for that reason, it could be open to constitutional challenge and be deemed invalid by the Supreme Court. So it would certainly be preferable to be in a position to have a properly constituted Seanad in 2 weeks' time. Whether we will need legislation in 2 weeks' time, that's a different question. There's nothing, if you like, on the books that we're not doing this week, but something may come up, and that's the concern. That's a real one.
To deal first of all with the question of testing, we've made a change at the meeting of the National Public Health Emergency Team yesterday morning to the case definition. We've done that 2 or 3 times since this began. The purpose of that is to give us the greatest opportunity of picking up the cases while not picking up other cases that we think have a lower likelihood of infection. That's something that happens all the time in responding to an infectious disease. The reason that we did it on this occasion is because after the last change 10 days ago, the case definition that was being used yielded a very large response in terms of demand for testing. Some meeting the case definition, some additional demand that was what you might call a reflection of the level of anxiety, worry and concern that might have been understandably in the population. We had something in the region of 20,000 people per day over the 10 days since we changed that case definition seeking testing. And if we test everybody at that level, we know that there's a very low yield, first of all, in terms of the likelihood. At the moment, it's running around 6%. We would also then become, in global terms, the highest testing country in the world by a factor of almost 2 compared to the next. This tells us that that strategy was leading us to direct our resources inappropriately. It was not helping in terms of our public health management, and it was not necessary or feasible for us to continue. So we adjusted the definition to increase the likelihood when a GP sees a patient or speaks to a patient of a decision that increases the likelihood of that being this particular disease. So that was the first thing that we did. The second thing that we did then was to re-emphasise the advice to the public, which has not changed. The policy has not changed and the strategy has not changed. If you have symptoms, stay at home, assume that you have this disease, contact your GP and your GP will guide you from there. If your GP believes that you need to have a test, then you will be referred for testing. That's the key measure that protects the population. And we're asking that people observe that particular step, that if they have symptoms, they stay at home, contact the GP, their contacts, the people who live with them, restrict their movements for 14 days or until such time as they have a negative test. And anybody who meets the new case definition will be offered a test in exactly accordance with that. We worked over the course of yesterday with both the ICGP and IMO to ensure that the general practitioners in the first instance have a clear understanding of that case definition and a clear understanding of the advice that they must give then to patients who contact them with symptoms. We need to ensure that as we continue to go forward, we grow our testing capacity, because our strategy is still to continue to detect as many cases as we possibly can, and we need to increase our testing capacity, we think, to something in the order of 15,000 per day over the course of the next 3 to 4 weeks, and that is the intention. And as we move through the next number of weeks, we will focus the testing then in a prioritised way, in line with the advice of the ECDC, to ensure that people who are sickest in the first instance, other priority groups like healthcare workers, are those that are prioritised for testing. And we changed our case definition responsibly and appropriately to ensure that we direct our testing policy, which is, as I say, to continue to detect as many cases as possible to those people who are most likely to have this particular infection. And I should say, we as things stand in testing policy terms, stand as one of the top countries in Europe in terms of the numbers of tests that have been performed. And we're not, we're one of the, there are many other countries in Europe who've simply dispensed with this requirement for case detection that we continue to observe in line with the advice of the WHO.
What's the updated figure, please, on the test weight?
So I know that we are working through the laboratory system to turn around these tests as fast as possible. Dr. Killian de Gascoigne last evening confirmed that the NVRL is now testing samples that were taken on Sunday. That was Tuesday when he was giving that information. That should give us encouragement that people will have a turnaround, something in the region when a test is done and with the laboratory of 2 to 3 days. But even if, I re-emphasise, if a person is waiting for that test, assume that this is the disease, self-isolate, and the contacts that you live with should restrict their movements. And we think that's a very important measure because the encouraging information that the Minister shared with you earlier of 20 contacts per case over a week ago, reducing to 5 per case now, tells us that the majority of the contacts of cases now are people who live with you. It's a household disease for the most part. If you follow our advice as a case and your contacts and restrict your movements or self-isolate for the 14 days that we are recommending, we think we can make a significant impact on the transmission of this virus, and that's the key public health measure. The test does not help us to do that. Your actions as a member of the public following that advice is what helps us to do that.